Well, Connecticut continues to brace for changes under the One Big Beautiful Bill, including stricter work requirements for programs like SNAP and Medicaid.
NBC Connecticut political reporter Mike Savino is joining us now live from the Capitol. Mike, what kind of response lawmakers were planning?
Well, Mike and Keisha, there's now talks of possibly dipping into an emergency fund to help create a state-run assistance program to supplement SNAP. Meanwhile, some lawmakers also want a bigger chunk of money out of that fund to help people get insurance.
The state of Connecticut set aside $500 million for this emergency, and it's time that we use it because we can't food bank our way out of this crisis.
A plea from advocates during a public hearing today to help people who could lose their SNAP benefits because the federal government is imposing stricter work requirements. Some Democrats are proposing a state-run program fueled by $40 million from an emergency fund.
Veterans, survivors of domestic violence, there are a whole bunch of different folks who are going to be losing food benefits that we really need to be doing everything we can to support.
The bill identifies vulnerable groups of people who could receive at least $192 a month for up to 12 months to replace federal aid. But the Social Services Commissioner says Connecticut would have a hard time creating its own SNAP program.
We would need terminals and cards and quality assurance and a fraud unit and all the things that we have for our current SNAP program, we would need to have for this particular SNAP program.
There's still $300 million in that emergency fund after Governor Ned Lamont used some of it to offset costs and to replace enhanced Affordable Care Act subsidies that expired last year. Senator Matt Lesser voiced his support on an upcoming episode of Face More Facts with Mike and Mike for another bill that would put $200 million into a trust fund to continue those subsidies at the state level. Republicans say the state can offer temporary help but can't afford long-term assistance.
We got to put some money in. It's all well and good to talk about health reform, but we got to put some money in.
We can bridge the gap when it comes to individuals who need short-term assistance, but it can't be long-term and it can't be a way of life.
Now, a spokesman says that Governor Ned Lamont still needs to review the idea of a health care trust fund. Another item on today's agenda was Governor Ned Lamont's Connecticut option. He's pushing a way to have the state negotiate a more affordable insurance plan for individuals who buy for themselves. From the Capitol, Mike Savino, NBC Connecticut News.